I think before we do anything, we have to say a very special thank you to DEC planners who planned to build this facility that we are under right now this year. They did a wonderful job. Really good afternoon, everyone, and welcome to Ulster County. I'm thrilled to be with you today to raise awareness for such an important cause, an issue that touches the lives of so many families. But before I begin, there are a few special guests with us here today that I'd like to acknowledge. Joining us, Ulster County Comptroller Elliot Auerbach, City of Kingston Mayor Steve Noble, Village of New Paltz Mayor Tim Rogers, Town of New Paltz Supervisor Neil Betez, Town of Rochester Supervisor Carl Chipman, Town of Amenia Supervisor, thank you for joining us from Dutchess County, Victoria Parati, Commissioner of the Office of Temporary and Disability Assistance, Sam Roberts, Director of New York State Division of Veterans Affairs, Eric Hesse, my friend, the President of SUNY New Paltz and member of the Mid-Hudson REDC, Don Christian. Doctor, thank you for joining us. President of Scenic Hudson and member of the Mid-Hudson Regional Economic Development Council, Ned Sullivan. Ned, thank you very much for joining us. And the President and CEO of Health Alliance of Hudson Valley, David Scarpino. A round of applause for them. Now, here in Ulster County, we are striving to become the healthiest county in the state. And we've made great strides in climbing the Robert Wood Johnson National Health Rankings. And in this process, we take fighting cancer extremely seriously. That's why we're so thankful for the governor's incredible efforts. You see, breast cancer is the second leading cause of cancer deaths among women in New York. And breast cancer has touched virtually every family. I know it's impacted my own family multiple times. Our mothers, daughters, and sisters, all who fall victim to this deadly and terrifying disease. For many, tragedy can be averted simply through early detection and quick action, which makes the legislation Governor Cuomo signed today all the more important. This new comprehensive action plan that the governor fought so hard for ensures that everyone has the opportunity for early diagnosis. It tears down barriers to screening, and it makes those screenings more available and even more affordable. And because of awareness efforts like this motorcycle ride and so many others across our great state, more and more people will not only know about the importance of getting screened, but also where, how, and when to get screened. No other state is tackling this disease more aggressively, and I am proud to stand here with the governor whose leadership has been instrumental in making this happen. Thank you, Governor. But now I have the great honor of introducing someone whose strength and courage in fighting this terrible disease has been an inspiration to us all. An individual who has touched so many lives simply by her willingness to openly share her experience with others. She bravely overcame her own fight with breast cancer and is now working tirelessly to help other women do the same. Ladies and gentlemen, it is my great honor to introduce to you Sandra Lee.
Well, I want to thank you all very much for coming out. And I want to also thank the governor, my sweetheart. I don't call him governor, but I mean at home. But my sweetheart, Andrew, not only for creating this initiative and passing this bill, but also for being with me and supporting me through the last year of dealing with breast cancer. You know, Andrew, I'm much like him. Thought, as did I, that this would be a very short, quick bout. And we're going on a year and we still deal with it nearly every single day. But for me, I'm lucky that I get to say that I'm cancer-free because of early detection. I'm pretty religious about getting my screenings every single year. I have to say that there was one year, a couple years ago, where I missed a year, and my doctor called me and said, "Where are you? Why aren't you in here?" And I said, "What are you talking about? I was just in there last year." She goes, "No, honey, that was 2 years ago. You need to come back in here and get your screening done." And I thank God every single day that that year wasn't the year I was going to be diagnosed. It was this year when I actually did do my screenings religiously. And that's one of the things that we have to pay attention to is our calendars and make sure that our daily lives and our overextended responsibilities don't get in the way of making sure that we go in for our annual checkups every single year. Because you can get an early diagnosis. You can be cancer-free if you catch it in the beginning stages. And I was very lucky to have had that diagnosis and to now say I'm cancer-free. And I'm also very lucky to be with just one of the most wonderful men in this country and probably in the world. I don't know all of them, but he is my number one, and he is going to make a difference in every single woman in this state's life so that she can take control of her own health and make sure that she's here for a long time to come, supporting and caring for her family and her wonderful men in her life. So with that, I give you our incredible Governor Andrew Cuomo.
Thank you. Thank you very much. Thank you. Today I'm a wonderful man. Yesterday, not so much. Tomorrow is a question mark, but today I'll take. First, to Mike Hine, who's doing a great job as the county executive. Let's give him a round of applause. To all the riders who got up very early this morning and rode up from Long Island, and we had a pretty morning. We had a steamy late morning, and then we had just a rainy ride coming up the thruway. Let's give them a round of applause because they did a really great job. To Sandy, you think you know someone. We've been together 11 years. And what I saw in her this past year was really amazing. Her strength of character, her conviction, and how she took a true negative and turned it into a positive. And took her pain, and rather than feeling bad for herself and wallowing in her pain, she said, how do I flip this, and how do I turn this, and how do I help other people? And that really is a testament to who she is. And let's give her a round of applause, please. We did a lot of good work this year on the state side. We passed a lot of laws that I think are going to make a big difference. We passed the best paid family leave program in the country. We raised the minimum wage to $15 so people can actually have a decent living. More money for education than ever before, and the lowest middle-class tax rate in 70 years, believe it or not. So we did a lot of good work, but I believe this is in many ways the most important piece of legislation because I believe this is going to actually save lives, this piece of legislation. We signed it earlier today. And, in life, I believe everything happens for a reason. And the past year has been a really difficult year because cancer doesn't just affect the individual. It affects the entire family and everyone who is near that person, everyone who is living with that person. And we had just lost my father last January. Passed away on the day of my inauguration, believe it or not. He waited for me to be inaugurated, And then literally on that day, he passed away. And then just a few weeks later, we heard Sandy's diagnosis. And I remember when we talked on the phone, she told me about it, and then I didn't want to ask her a lot of questions, so I called the doctor afterwards. And because it's just shocking when you hear that, and Sandy's a young woman, and you wouldn't expect it, and there's no family history. And the doctor said, in the fog that I was in, the doctor said, the good news is luckily we caught it early. And I remember saying to myself, luckily we caught it early. Why should it be a matter of luck that we caught it early? I mean, this is a matter of life and death. You look at the numbers. If, depending on when you detect the breast cancer, can make a difference between whether or not you live or die, literally. And why should it be luck that it was an early detection? And Sandy said she missed one, she happened to make this year. Why should it be a matter of luck? And that question never left my mind. And all through this period, everything for a reason, as a matter of luck. I took every opportunity I could in the hospital, with the doctors, with the nurses, with patients, asking women, why didn't you get screened earlier? Why didn't you get screened earlier? We're just with a woman at Bear Mountain, stage 4 cancer. And she was crying in the audience. And she said, if I had gotten screened earlier, my life would be totally different. And I would say to the women, why didn't you get screened earlier? And literally made a list of what they said. And this legislation then answers all those questions. The first question was, well, I didn't go because it's too expensive. Don't you have insurance? Well, I have insurance, but I have a copay, I have a deductible, and it's too expensive. This legislation, for the first time in history, only state in the nation, makes the insurance companies pay the full cost of the screening. Think about that. There is no copay, there is no deductible, they pay the full cost, and they pay the full cost of any secondary screening. If you have to go for a second test or a follow-up or whatever, they pay for the full cost of screening. The second reason was no time. I have the kids, I'm working, and there's just no time. This legislation says the 200 hospitals across the state of New York must stay open additional hours per week after 5 o'clock and on weekends so women can get the screenings done at a time that works for them. That's the second thing it does. And the third reason was people said, well, you know, it's too complicated. I don't know where to start. We set up a website. We set up a system of what we call navigators. There's a phone number you can call. You actually get a person, and the person will walk you through the system, the insurance, what hospitals are in your area, what time they're open, and can actually help you set up the appointment for the screening. So we say there are no excuses. Couldn't afford it, the insurance company is going to pay. Couldn't find the time, we'll change the hours. They'll be available when you're available. Well, it was too complicated. There's a website, there's a person who will talk you through the whole system. There is no excuse. It shouldn't be a matter of luck. You just have to do it. You just have to do it. And that's what this motorcycle ride is all about. Bringing attention to it in a somewhat novel way, but trying to say to people, you have to do this, and think about it differently. Because we took care of the first three. But government can only do so much. It's still up to the individual to take that step, get past the fear, get past the denial, get past whatever block is keeping you from not scheduling that screening, and go. Literally, we will save lives with this law. 15,000 new cases every year. 15,000 new cases every year. That's in addition, another 15, another 15, another 15, another 15. It's all the difference in the world. It is literally the difference between life and death. You can do it. We can do it. We're going to do it. The only state in America that has this program is the state of New York. You use it. Thank you, and God bless you.
Again, to each and every one of you, thank you so much for joining us here today. Governor, there's no way to say thank you enough for you making this a priority. You're saving lives, making a difference in the lives of families all across this state and hopefully all across this country. So a very special thank you to you. And Sandra Lee, thank you so much for joining us today. Thank you all.